Healthcare is too expensive. Employers are offsetting costs onto their employees. Who will make health benefits affordable for hard-working Americans and their families?
You will! This is the Empowering Plans Podcast, a show dedicated to helping you once again emphasize the benefits in your benefit plan. Now prepare to learn,
Plan,
save,
and protect with the Phia Group. Hello, everybody. Welcome to another Empowering Plans Podcast with the Phia Group. Ron Peck here, live from the new Phia Group podcast room. The acoustics are amazing. Chief Legal Officer of the Phia Group, that's me, and next to me is the person I rely upon for all the wisdom, innovation, brilliant things, products, services that we provide to the industry. Jen McCormick, my dear friend. We've known each other almost half my life at this point, I feel like. I think that's mathematically correct. I'm not so good with the numbers. I apologize. Being what we're in our mid-20s, I've known you since we're little kids. Our executive vice president of consulting, climbing that ladder. Jen, how you doing today?
I'm great. How are you? Are you ready?
I'm feeling ready. I mean, what do you think of the podcast room?
I think this is an incredible room. I'm glad that we're able to be here together and in these amazing microphones and this great sign behind us.
Yeah, shoot, this table, huh? Solid construction. Pat, the man Santos, our producer, is over there in the corner. There's lots of blinking lights, different colors. It looks like a Christmas tree. Happy holidays. Jen, you and I were emailing back and forth. And we're saying, what are we going to talk about today? What are we going to talk about during our podcast? And you're rattling off these really great ideas and this thing and that thing about, specialty drugs and GLP-1s and legislation and litigation. And as I'm looking at it, I'm thinking, we always talk about healthcare, the health benefits industry, plans, carriers, payers, providers. And I had just come off a phone call with an employer group. All right. So we've got a plan. They sponsor it. And they're being asked to pay these claims, and they're pretty substantial. And in talking to this group, someone brought up, well, how much are we talking about? What are the outstanding claims out there? And one of the representatives from the third-party administrator, they mentioned, I think right now the outstanding claims are something like $400,000, $500,000. And this employer's jaw just drops. And, he's thinking, well, is stop loss going to kick in? Are they going to pay the claims? And there's some dispute as to whether stop loss will cover it or not. And we don't have to get into detail. But the fact that his jaw dropped in the first place shows that the dollar amounts we're talking about when it comes to healthcare, those of us in the industry, we hear 500,000, a million, and we don't even blink. We don't bat an eye anymore because we know that's what it costs. But if you're a CEO at a company, a factory that builds automobiles, or you're a grocer working at a food market or whatever it is, and you hear these numbers, you're like, does anyone charge that much for anything, right? If I tell you, you want to get a Rolls Royce, $500,000, you're like, oh yeah, Rolls Royce. Who drives that? Who can afford that? And yet we're paying for a Rolls Royce every quarter with these medical bills. And it got me thinking, if I was an employer and I'm not in this industry, and someone tells me for the first time that that's what it costs to treat this person's cancer, to take care of that premature baby, to pay for that medication, what goes through my head? And what's the trickle-down impact outside of my health plan? And I think we should really focus on that today, is to talk about where are we seeing the greatest threats from a cost perspective for these plans, but additionally, how do we foresee that impacting these employers outside the plan, so that we empathize a little more and understand where these employers are coming from, so that we can provide the right type of advice and guidance. One of the things that he mentioned when we talked about that number was their overall budget and how this was going to affect their recruitment and hiring. that if they're spending, 500,000 on a medical plan, that they have to delay paying salary to new employees, and that they have to either suspend or completely cancel hiring new employees. And I kind of thought that was interesting because if you look back to the origin of these health plans, they were meant to be recruitment tools.
Yeah.
And now it's preventing you from recruiting. So it's almost the opposite of what the intent was. Um, and so I thought that was interesting how the cost of healthcare prevents an employer from hiring, which in turn has an impact on
Right.
unemployment rates. Um, I know you've got some examples of high cost claims, areas where we're monitoring and seeing, a rate of cost for healthcare going even more astronomically, exponentially than a lot of the other costly healthcare that we monitor. And I'm sure you have some thoughts about how that could potentially impact those who are being asked to pay for it.
Right. And I think that's really timely to have had that discussion. I think a lot of what's happening right now and we need to start thinking about is more of a mind shift in the way that we're thinking of our perception because we can't stop claims from coming in. But what we can do is try to manage them. We don't have to cut them, but we can manage them. There are quite a few things that we're starting to see. Inflation, no doubt, is part of this equation. It's unavoidable, unfortunately. And we're starting to see a lot of these inflationary costs with premiums and contributions all across the board.
Right.
But I think one of the big issues that we're seeing, particularly when it comes to RX and these GLP-1s, that seems to be something for, I guess at the outset, people thought this would be something that would only be occurring as a high cost for year one or year two. But this is really being sustained over the course of time. We're seeing continuing and increasing costs in the GLP-1 space. So at the outset, there's a lot of conversation about all of the other potential cures and treatments that these sort of drugs could work for. But now there's these individuals on these plans. These plans are feeling a bit stuck.
GLP-1s, that's a really good one. And I know a lot of people have been talking about that. And it's amazing. I mentioned before this trickle down effect. All of these sort of other industries that this GLP-1 revolution has sort of fed into. One of the areas, and if you were doing this 10, 20 years ago, one of the things people talked about a lot were wellness plans and wellness programs. And, if you walk your 10,000 steps, you get a free water bottle, right? And the question was, well, is this a benefit plan? And if it is, does it have to meet the requirements of law? Is it a benefit under an existing benefit plan? And, is it equally available? And what are the terms? So all these complications that sort of jump in. And of course, the application of GINA and genetic, testing. And can I test your BMI or am I violating GINA, HIPAA? How are we protecting the information? It made it hard for these wellness programs, which again, the intent was great. Get everybody to stretch midday and do some jumping jacks. Why not? But all this minutia, it resulted in wellness programs never really taking off. And so it was always just sort of under the surface with these complications that people were encountering when they tried to implement these programs. Now you've got employees who are saying, hey, look, my doctor's telling me if I don't lose weight, it's going to result in major complications and that I need this GLP-1 in order to reduce my weight. And the employer is thinking, well, I don't want to pay for that. What are alternatives that I can pay for that would help you
Right.
lose weight? Things like they're starting to revisit, hey, would surgery be less expensive? Should I pay for surgery? Is there a sort of a step plan that I can put into place where first you meet with a nutritionist and focus on diet. And then if that doesn't work, the next thing, and then the next thing, and then the last step is a GLP-1 or surgery. Another thing is they're starting to revisit the possibility, is it worth going through all the complications and difficulties of implementing a wellness plan? Because years ago, implement it or not, it was a nice thing to do, but really it didn't save me anything.
Right.
Now, maybe I avoid the cost of GLP-1s if I do implement wellness plans.
Right.
And I'm just wondering, from your consulting perspective, are you starting to see a rekindled interest in things other than GLP-1s whose intent are to reduce weight and improve health?
Yeah, and I don't think the answer is necessarily to cut or reduce benefits. I think the strategy is really how can we best manage them? And there are other protocols and things that people are putting into place that you can maybe have a step therapy program put into place, try something else first. Or maybe there's certain criteria that you need to put into effect prior to something being appropriate for that individual's use, or limiting the scope for when you're able to access that type of medication. I think there certainly are different tools that you can really utilize when it comes to it. But part of this problem and why we're seeing some of these increased costs this year, I really think is, and I hate to go back to COVID, but during the COVID times, people didn't go to the doctor. We didn't see claims. A lot of things were not happening, whether it was a scheduled chronic condition appointment, you were missing it, you weren't following or dialing in for your virtual appointment. So people didn't get care. And what happens 5 years later is what something was intended to be a preventative or maybe even a management type of service or check-in or treatment has now almost become a crisis. And it is costly because now surgical intervention in some cases is now required. So a lot of this, I think we're playing a little bit of this catch-up game here for that missed time where people weren't going to the doctor. I mean, none of us went to the doctors, right? Everything was virtual. So I think we're starting to see this bubble, and hopefully we can get back to this practice where we're incentivizing individuals to access preventive care. It's maybe through the DPP, maybe it's through a virtual appointment, but not delaying the care can mean that we're catching things earlier and that whatever it is of the treatment that would be appropriate for that individual maybe be less costly today as opposed to 5 years later when they're in the emergency room instead of having an appointment with their primary care doctor.
So it feels like we're almost talking about the butterfly effect in a lot of ways, right? So far, we've talked about how just the general increase in the cost of providing healthcare in general is affecting your ability to hire people, right? We've talked about how the cost of GLP-1s as compared to how popular they are is resulting in plans reconsidering other things like surgery, wellness programs. We've talked about how things like the pandemic and missed healthcare is starting to catch up to us and the things that couldn't be done virtually. You know, speaking of sort of the butterfly effect where this affects this, another area that we're starting to see a lot more interest has to do with HR and employee relations
Mhm.
in general.
Yeah.
And where that conversation starts, and I want to turn it to you because you are, you're elbows deep in this mess, right? Is that for the longest time, the policy on the part of an employer and their broker advisor and their third party administrator has more or less been, listen, we don't want our employees to have to understand all of the details of the plan. We want them to know they're taken care of, and we want them to feel confident in their benefit plan. And so a lot of weight is placed on the network logo, right? Yeah, we have a self-funded plan, and the financial strength of our plan is based on the money that we as an employer have available to us. But I don't want my employees to know that. I want them to feel like someone bigger than me has got their back. Well, good for us. We've got the fill in the blank logo network, right? Your Blues, Aetna, Cignas, right? United, large companies with a great reputation who have that financial wherewithal and a power that make you feel confident that they've got your back. And so employers who self-fund their plan allow their employees to believe that they've got traditional insurance because of the network, right? Someone will look at their card and say, I've got Blue Cross Blue Shield insurance, when reality is they've got a self-funded plan with the Blue Cross Blue Shield network.
Mhm.
But they don't know the difference between self-funding and insurance. And that was allowed to sort of go on and on indefinitely for a long time. And I understand why the employers and wanted to do that.
Yeah.
Keep it simple, let them feel good, move on to the next thing.
Yeah.
But now, as the costs continue to go up, we're asking people, hey, you need to think twice before you go and get that service. Before you go to the emergency room, is it actually an emergency or can you go to urgent care? Before you go and get that drug, is there a less costly alternative that's equally effective? And what those employees are thinking is, why do you care so much? Isn't that the insurance company's job? Isn't that their money? Why are we working so hard to save them money?
Right.
And as an employer who self-funds, you're like, oh, how do I tell them now that it's not an insurance company's money, it's their money?
Right.
That we're trying to save them and our company money, not the big carrier that sponsors the network. And so how do you do that in a way that is tactful, that doesn't lose support of the staff, but gets them to understand for the first time ever, hey, we're self-funded. Here's what that means. Here's why it's not a bad thing.
Right.
And here are the things that you can actively do as a consumer of healthcare to benefit your own health and your financial health as a plan member and sponsor. And we at the Phia Group have been doing that for years and years and years. We're not trying to hide that we're self-funded to our staff because, frankly, that's what we do, right? It would be silly not to be self-funded when we're servicing primarily the self-funded industry. And so we're a few steps ahead. That transparency, that explanation, that education. And employers are starting to reach out, Jen, to you, to your team, asking, what do we do? How do we educate them? I don't know if you want to share some of the experiences you are having and how this really sort of impacts how HR departments at these employers look in the future.
Yeah, I think that now it is important for an HR team to have visibility within the company as it relates to the benefits by having these meetings and having these conversations. I think there are a couple of takeaways if we're talking to the teams and to individuals, but what they can do to really help to encourage these conversations. I think the first piece is that there is this transparency. We want to make sure that we're inviting these conversations. And oftentimes, if people feel like if they have skin in the game, they understand this is a we problem, they can contribute to the success of the company and to themselves. Because ultimately, if they're saving money for the plan, they're saving money for themselves by ensuring that the cost of the contributions go down, the deductibles don't go up. But we've done that through a lot of different programs that we have. For example, if you are reviewing your bill and you notice that there was a service that you were billed for that you didn't actually receive, bring it up. Don't ignore it. If you realize that maybe something occurred or it shouldn't have occurred, or there's some other error or issue or a coordination, maybe there's another plan at play and maybe something wasn't handled correctly, talk about it, bring it up. And you can incentivize that sort of behavior financially by rewarding some of these individuals for taking a look at those bills and making those choices. I think the other thing, too, about communication between the employees and between everyone is that by being self-funded, you're not locked in for a 12-month period. This is it. There's no changes. You have this flexibility. You can adapt. If you see, oh my gosh, there's this new something that's coming to the market, I think that our population would really be able to take advantage of this, and this could create savings and could save lives and have a preventative effect for a lot of people. If you're self-funded, make the change. You can add those types of programs that really gives you that flexibility. So allowing people, helping people to understand that you are part of this, you have skin in the game, that you can make a difference. Maybe they would be more intrigued in what options would become available to them because they have the opportunity to have that change mid-year after 3 months and not after 12 months.
It's funny because when you listen to just people in general, the media, politicians, business people, whatever, and you talk about healthcare and health insurance, they always reference it as if it's this. What did they call? I can't remember. It was a snake. It was too big. We couldn't cut off the head of the beast. You hear a lot of that. That's the steel curtain of healthcare, and you can't get behind. You can't figure it out. And when you really break it down to its basics, it's actually not that complicated. The basic economic rules that apply to all commerce apply here, which is that if you want me to pay for things that are expensive, the money needs to come from somewhere, right? And it's amazing because people understand that when it comes to other types of insurance, right? How often do you hear of someone who has auto insurance and they're paying the premium and they buy it because they have to? It's required by state law, whatever it is, unless you're in New Hampshire, live free or die, and so you have this auto insurance, but you have a fender bender and you get out of the car and you're looking at the other person. You're like, listen, man, I don't want to report it to my insurance. They're going to increase my rates way more than I have to. It would be cheaper for me to just cut you a check right now and pay for this. Can I just pay you out of pocket? And you go, yeah, I don't care as long as it gets fixed, right? I am so desperate to protect my auto insurance from that claim because I know how that claim is going to impact my out-of-pocket expenses down the line when they increase my premiums, and yet replace the word car or auto with health, and suddenly it's, hey, man, that's what insurance is for. Going to the hospital, right? Getting that rash looked at, and they look at it and they say, oh, yeah, it'll go away. Don't worry about it. Just throw some ointment on there. You're going to be fine. And the nurse says, is there anything else bothering? And you say, yeah, I got a headache. And they say, can I get you an aspirin, right? Most people, they say, oh, yeah, don't worry about it. I got aspirin at home. I'll take it when I get home. And they say, no. Let me get it for you. We got some here. That's what insurance is for.
Right.
Nobody says, I don't want to file that claim. That's going to increase my rates. Let me take care of it out of my own pocket. No. Why? Why is there that different mentality, right? And how do we get people to understand that whether you're talking about auto insurance or health insurance or any other type of insurance, even if it's not self-funded, at the end of the day, if things cost more and you're using it more often, the cost will eventually trickle back to you.
Mhm.
Getting people to understand that, and at the same time, we don't want to go back to the days of the pandemic, like you mentioned, where people say, well, I want my rates to stay low, so I just won't get healthcare.
Mhm.
We need to give them a better option, right? We don't want people to purchase healthcare with abandon without
Right.
thinking, but we also don't want people to avoid healthcare
Right.
to their detriment. So that third option is being able to identify the best quality care, the best time to use it, how to use it, and where to purchase it. And getting people to understand that the cost has nothing to do with the quality. And you should focus on quality first, which in turn will result in cost savings. So that preventative care, leveraging urgent care instead of the ER, leveraging your primary care physicians or direct primary care instead of waiting for something bad to happen and going to a specialist. If you have a chronic disease, taking that medication. If you are able to implement activities in your life that will avoid you ending up in obesity and needing that GLP-1 after the fact,
Right.
instead of waiting until you need the drug. Things that you can do now that better your health and reduce costs. Um,
I think that's part of the
yeah,
homework, right?
it is.
For the takeaway here is to make sure that we want to have the highest quality and those cost effective options available, but for the right targeted conditions too. Because by finding the best provider for the best service, if no one on your plan needs that service, that's irrelevant, right? So you need to make sure that you have this delicate balancing act that people are encouraged to go to the right places for the right things at the right times. So you really need to make sure that you're doing this analysis, having these conversations, and really understanding the needs of your particular population.
A lot of employers say to us, how do we do that? How do we have these conversations? And, when do we get them? And the low-hanging fruit that we've suggested before, and I think we could finish with you kind of explaining when we do it with our own employees, right? And look, we get new employees who come here and they were in the banking industry or in the restaurant business. They have no background in healthcare. And yet, after the implementation and the training and the enrollment meetings, which you could talk about, suddenly they're a pro and they're sitting at the Thanksgiving table explaining healthcare to their entire family. Where are we getting them? How are we getting them? And getting them to understand how this works without losing them and saying, I don't want to be part of a self-funded plan. I'm out of here.
Right.
So we're inspiring confidence and at the same time teaching them to care about the bottom line. Where do we do that? How do we do that? And can other employers replicate it?
Yeah, and thankfully, we're able to manage a lot of these costs so that we can continue to grow our training team so we can have these conversations and have these enrollment meetings. I think
Lord
that
willing. Yeah.
it is critically important to sit down or have a Zoom or whatever would be the best scenario for having these conversations. We do have an annual enrollment meeting where we go over and highlight all of the benefits of our plan. How exciting that you're able to say, under my plan, I helped ensure that we got to cover acupuncture, that we got to cover urgent care with a $0 copay. How exciting that you get to be part of those conversations. So by highlighting and exciting your entire team about the benefits that they have available to them and how to use them, it really helps them to use them in the best way possible. We make sure that by having those conversations, everyone is present. There's handouts, there's videos, but we also understand that it's not only the employees. We offer coverage for families. And we want to make sure that the families have access to this, whether it's a cartoon or it's some other handout or cheat sheet that you're able to reference. We want to make sure that every individual understands the benefits, the beautiful benefits that are available to them. And that can only be done by having these meetings, reminding people, posting things on your intranet or wherever your website might be that you have for your company so everyone knows where to look and who to ask questions. Ask HR, ask your plan administrator. It's important that if there is something that's confusing, you ask about it.
You know, Jen, you point at me when you say cartoons. I want people to know I'm not a cartoon, but we do have a cartoon Ron who's part of a training video, and it is geared towards the general public. So it's not just employees who are working here, part of the industry, but also their spouses and adult dependent children so that it can understand what is self-funding, how does it work, why is it good, how do I help contain costs without reducing the quality of my healthcare? And people who watch this video, they come to the holiday party or they come to the Halloween party here at the office and they tell us, hey, I watched that video. I learned more about healthcare in that 5-minute clip than I have my entire life of going to the doctors, right? And so that's really it, is make it simple, make people care, get them to understand, incentivize certain behaviors. It's that carrot stick approach. It's not as tough as you think. And I know that we've had employers reach out and ask, "Hey, can I get those materials for my employees to teach my staff what it is and how it works?" And we've done it and it worked
Absolutely.
for them too. So you don't have to be in the industry to make this something that people just understand. And hopefully we can make people a little bit more literate when it comes to their healthcare and how it trickles down to them. Save some money, get that hiring back, get those employees recruited, maybe cover things like GLP-1s that people want because you're saving so much money, reduce those copays to zero and push back. Hey, this has been a lot of fun. If you're interested in learning more about how we can help educate employers and employees on what self-funding is and why they should care and how they could reduce costs at that grassroots level, give us a ring. We're always here to help. On behalf of myself, Jen McCormick, Pat the Man Santos, the greatest producer at Phia Group. There aren't that many. Thank you once again for joining the Phia Group for another Empowering Plans podcast. We appreciate your time. Be well.